everyone. You ever get that weird feeling away in the back of your jaw and wonder what's going on back there?
Yeah, today we're diving deep into wisdom teeth, those mysterious molars that seem to have a mind of their own.
They really do.
So I was checking out this piece on emergency wisdom tooth removal, and it got me thinking,
Oh, yeah.
how do we even know when those things are being problematic?
Hmm.
Like, when is it time to actually do something about them?
Well, I think the simplest way to think about it is it all boils down to space, really.
Okay.
It's like, those wisdom teeth or third molars, if we're getting technical. They're like the last guest to show up at a party, right?
Right.
Sometimes there's plenty of room, everyone's comfortable. But a lot of times, our jaws just weren't designed with enough space to accommodate them.
So it's less like rebellious teenagers and more like a not enough room at the end kind of situation.
Exactly. And when those wisdom teeth try to push through with nowhere to go, that's when they can get impacted.
Uh-huh.
Imagine trying to fit a big, overstuffed armchair into a room that's already crammed full of furniture.
Ooh, I can picture it.
That's kind of what happens with an impacted wisdom tooth.
Ouch.
It gets stuck, sometimes sideways, sometimes at an angle, and it just causes all sorts of problems.
Okay, yeah, that visual really helps, actually. And I'm guessing those problems go beyond just a little discomfort in your mouth.
Oh, absolutely. Impacted wisdom teeth can crowd your other teeth, leading to pain, shifting, even damage to perfectly healthy teeth.
So it's not even just about the wisdom teeth themselves. They can impact, like, the whole neighborhood of your mouth.
Yeah, exactly.
Okay, so say you're one of the lucky ones. You've got enough jaw space. Your wisdom teeth are coming in straight.
Mm-hmm.
Are you in the clear at that point?
You might be. If there's truly enough room and they're erupting perfectly straight, you might be good.
Okay,
But that's where those regular dental checkups and x-rays are super important,
that makes sense.
especially during the teenage years when those wisdom teeth are making their grand entrance.
So it's like having a crystal ball, but for your teeth.
Yeah, you could say that.
You can catch those potential problems early.
Hmm.
So it's making me think about, like, all the people I know who put off going to the dentist.
Right.
What happens if you just, like, ignore those early warning signs?
Well, let me tell you. Procrastination is real, and we've all been there. But when it comes to those wisdom teeth, ignoring those early warning signs can turn like a minor inconvenience into a major dental dilemma.
Okay, that's what I was afraid of. What are some of those signs that we should be looking out for? I mean, beyond the obvious, like, pain.
Right. Well, pain is definitely your body's way of saying pay attention, but sometimes those signs are a little bit more subtle.
Okay.
You might notice some tenderness or even swelling in your gums, way in the back where those wisdom teeth are lurking.
So that slight tenderness, that's not just me chewing on my toothbrush the wrong way.
Well, maybe not.
Okay.
That tenderness a lot of times signals inflammation,
Right.
which is a sign that the tooth is trying to break through, but it just doesn't have the space to do it.
Yeah.
And then there's the issue of shifting.
Oh,
You might not even feel it happening, but those impacted wisdom teeth can put pressure on your other teeth,
Uh-huh.
and that can cause them to slowly move.
See, now that's concerning,
Mm.
especially for, those of us who spend our teenage years in braces.
Yeah.
It's like all that work for nothing.
Mm.
So we're talking pain, tenderness, shifting.
Yeah.
Anything else we should be keeping an eye on?
Yeah, those are some of the most common ones. But, impacted wisdom teeth can also be these kind of silent troublemakers,
Oh, no.
leading to issues like jaw pain or even like recurring headaches,
Mm.
things you might not even necessarily like immediately associate with your teeth.
Yeah, that's true.
And then in some cases, they can even increase the risk of developing cysts.
Cysts. Okay, now that sounds a bit unnerving. What exactly are those?
So basically, cysts are these fluid-filled sacs that can form around an impacted tooth.
Okay.
Now, most of the time, these cysts are totally harmless.
Okay, good.
But if they're left untreated, in some rare cases, they can potentially weaken the jawbone, which can then make it more susceptible to fractures.
Okay. That's definitely not something I want to mess around with. So it's like, even if you're not feeling any immediate pain, those regular checkups are still crucial to catch this stuff early.
You hit the nail on the head. It's all about early detection.
Yeah.
Think of those dental x-rays as a preventative measure,
Okay.
not just a diagnostic tool,
I like that.
They can actually reveal these hidden problems like those cysts or even impacted teeth that haven't even erupted yet. And that allows for early intervention and, less invasive treatment options down the line.
Right. It's like that saying, an ounce of prevention is worth a pound of cure. But let's say someone's been putting off that dentist appointment and all those kind of like warning signs have turned into a full-blown problem.
Mm.
What happens then?
Well, in those cases, an emergency extraction might be necessary.
Oh,
It's not ideal, but it's often the best course of action to prevent further complications.
Okay, I'm starting to see why ignoring this is a bad idea.
Hmm.
But what exactly happens during an emergency extraction? Is it as scary as it sounds? I'll be honest, it doesn't sound like a walk in the park.
I get it. The words emergency extraction, they don't exactly scream relaxing spa day, do they?
Not really, no.
But honestly, it's often a lot less scary in reality than it sounds.
Okay, good.
First of all, your dentist or oral surgeon, whoever's handling it, they're going to make sure you are completely comfortable, usually with a local anesthetic to numb the area.
So, no feeling a thing.
Exactly. You're numb.
That does help.
And, if you're someone who's prone to a little dental anxiety,
Right.
there are options like sedation dentistry
Oh, true.
that can help you feel more relaxed.
That makes sense. Okay, so you're all numbed up, nice and relaxed. What happens next?
So the actual extraction process itself, it basically involves gently widening the tooth socket.
Okay.
And they use these special instruments to kind of loosen the tooth before carefully removing it.
So it's not like, like we used to imagine as kids, that they're yanking it out with a pair of pliers.
No, nothing like that.
Okay, good.
It's a very controlled and precise procedure. They might need to use a few stitches to close up the gums afterwards, but it's generally much quicker than people expect.
Okay, that's good to know. But what about the whole recovery process after that? I've heard tales of pain and swelling and living on milkshakes for a week.
Yeah, you're going to be best friends with milkshakes for a little bit.
Okay.
Those first few days are all about being kind to your mouth. There will be some discomfort, as the anesthesia wears off, and you might have a little bit of swelling.
Yeah.
And definitely want to stick to those soft foods for a while.
Like milkshakes.
Exactly. Smoothies, yogurt, soups, things that aren't going to irritate that extraction site.
So the milkshake rumors are true.
They're true.
Okay, good to know. Anything else we should be prepared for in those first few days?
Your dentist will probably prescribe some pain medication just to help you manage any discomfort. And they'll give you some detailed aftercare instructions as well.
Right.
One thing that's really important is warm saltwater rinses.
Yeah, I was going to say, my grandma always said salt water fixes everything.
It's like the OG mouthwash,
Yeah.
And it really does help. It keeps things clean and helps promote healing.
Makes sense. So warm salt water rinses, milkshakes, anything we should absolutely avoid during recovery.
Yes, definitely. Steer clear of straws, smoking, and spitting.
Okay.
Those can actually dislodge that blood clot that forms in the empty socket,
Ooh.
which can then lead to something called dry socket, which is
Not good.
not good, not a fun time.
So we are avoiding straws at all costs. Okay, good to know. So assuming we're following all the instructions, avoiding dry socket, when can someone realistically expect to feel back to normal?
Most people start feeling significantly better within a few days, and they're generally back to their regular activities within a week or so.
Okay.
And the good news is, complications from wisdom tooth extractions are pretty rare.
That is good news. So if we were to leave our listener with one big takeaway today,
Yeah.
the one aha moment to remember about this whole wisdom teeth dilemma, what would it be?
I think the biggest takeaway here is just knowledge is power.
It really is.
Understanding your own anatomy, being aware of those potential issues, and knowing when to seek professional help. That's how you advocate for your own oral health.
So well said. And on that note, if you're experiencing any of those symptoms we talked about, the pain, the tenderness, the shifting, don't wait. Go schedule a checkup.
Exactly.
And even if your wisdom teeth feel fine right now, those regular checkups and x-rays, those are your secret weapon to catch any potential problems early on.
Absolutely.
Because like we've learned today, a little preventative care can save you a whole lot of tooth trouble in the long run. Thanks for diving deep with us.